more, they point more toward natural disasters than they do this pandemic or disease outbreaks. And it was never envisioned to be something that could supply everyone asking at the same time. It was always about, well, something has happened in New York City exclusively, or a hurricane just hit someplace in Florida or Louisiana. And the inception and concept of operation was we could send supplies in while the rest of the United States, untouched by this natural disaster, would then flow in supplies in a rather quick but not necessarily immediate reaction. So today, unfortunately, we're in a new world, and the stockpile has more than 10,000 vents, and there's a question politically and economically, do we give those to CDC? And I really should say right now, I'm not representing anybody. I'm an old retired knuckle dragging man, and I don't represent CDC. I don't represent the federal government, or I don't represent anybody but myself. So right now, those
Bainbridge MRC.
Well, thank you. Yes, and I'm proud to do that. Thank you, David. Those vents and a variety of other things, including several million masks, are in repositories around the United States. The problem that the feds are having, apparently, is, well, we can't give everyone everything that they want. So there has to be some sort of an algorithm which points out the hot spots and decides at a national level that New York, Washington, Seattle, Los Angeles, those are the hot spots, and then divvy up what's left or what is in the stockpile. That's an opinion, but it's not being done. And there's much consternation and aggravation about what is being done. And clearly, we are putting our providers at risk by not giving them everything that they want. And I don't think we can rely on the supply chain such as it is. It's been stressed for the last 10 years. It is overly stressed at this point and not functioning at all well. So I'm not saying that people aren't functioning. I'm saying that the supply chain dynamic is not functioning. For the most part, it's just-in-time inventory. If you were out of something, you ordered it, and the next day, if you were lucky, it got there. Today, you can order it, and in the next week, it may not even get there. So there's that issue, and I'll go on from there. The testing issue, we desperately need point of contact, point of entry tests that can show clinicians results in, like 15 minutes. Waiting days, and in some cases as much as 10 days for a result, compromises the clinical care, compromises the clinician, and certainly it compromises patients who are at great risk. So we absolutely need those. Other countries, such as South Korea, have those, have had them from the day they started their, or knew that they were in a pandemic situation. I won't conjecture about why we didn't have them. I know CDC made a huge mistake in its initial rollout of the test, and that's just an extreme shame. But recovering from that has not been easy, and it's certainly spotty around the nation. And it makes life extremely difficult for patients, clinicians, and others. the last thing that I can talk about is the near future and a much longer distance future. And I know some of you know this again much better than I do, but once a virus has spilled over, in other words, has come over from another species, in this case perhaps bats, but that's not unusual for coronavirus to be harbored in bats. But in any event, once it does spill over, it's in the human arena forever, literally forever. It will drift sometimes as it stays around. It may even antigenically shift, but it will be here forever. And until we get a vaccine, which is 12, 18 months away from now, or until we have a great percentage of our population which has been infected, thus, conferring some sort of herd immunity, we're going to have to do all the things that CDC and Dr. Fauci from NIH and others have said for us to do. To think that we can abandon those recommendations in something like the next few days, weeks, in other words, by mid-April, I believe is just not appropriate. I think we're going to be right in the middle of this. I'm not alone in thinking that. The really smart people around the world think that we are on the front end in the United States of our worst situations to come. And unfortunately, I do too believe that. So I'm willing to talk about David was asking me about the L and S strains, and I called a friend at CDC. That study that talked about the two different strains, one very aggressive, called the L strain, and one less aggressive. That was a small study done out of the China CDC and a university in Peking or Beijing, and it deserves a lot further study. But it's clear that the virus has changed a little bit along the course of its current procedures or processes, and it will continue to change. Whether one strain is more aggressive than another and which strain is where remains to be seen. Clearly in the United States, without a tremendous amount more testing, many questions are up in the air, haven't been answered, can't be answered. So that's a niggling and sad point, but it's the truth, at least as far as I see it.
I did just hear, if I can jump in, I did just hear some good news just before I came on the call that that the Gates Foundation has partnered with Amazon and is going to roll out a home testing regime where the Gates Foundation is going to pay for and supply the kits, and Amazon is going to drop off and pick up the test kits. I believe this will be in Seattle. I mean, in their, the normal Amazon 1 hour delivery area, of which we are not part. But it is quite possible that that effort could generate a very large number of results quickly without putting healthcare workers at risk and without without increasing the burn rate on our precious PPE.
It's interesting when a patient at some of the major hospitals is just been intubated. It's not unusual to have 2 physicians called into the room. It's not unusual to have respiratory therapists there. It's not unusual to have 2 or 3 nurses. All those people have to gown up it, and their thinking is, okay, this is a COVID patient. Once they leave that room, all that stuff gets taken off. It's a one-time use. There have been some suggestions which say, oh, well, with this disease, you don't need to do this, or gee, just put a scarf around your face. Some absurd recommendations that really put everyone at risk. If we lose our providers, we can kiss it goodbye, to use an old infantry term. So,
and PPE, for those of you who might not know, is personal protective equipment. So things like gowns and masks and gloves, right?
Thank you. Yes. I'm certainly open for some questions. Got some time to do it, if you like.
Yeah, I pretty much put everybody on mute, so you'll need to unmute yourself if you have a question. I guess the thing that comes to mind for us is, given what you've just described, it sounds like we should be prepared to continue to be very careful about our activities and contacts for some time to come.
Yes. Simple answer is absolutely yes. I understand getting America back on its feet economically. I understand the issues surrounding our stimulus package that was passed. I understand those issues, but economics and politics are not bad bedfellows. Economics, politics, and medicine are not necessarily good at sleeping together, and somebody is going to get hurt if we, I don't want to use the word Trump, if we sacrifice one for another. In other words, staying the course where we are now, it's uncomfortable. I appreciate that greatly, but it is the recommended course from people far smarter than me.
Okay, Bonnie, did you want to have a question? I saw you had turned on your microphone, Bonnie.
Oh, I'm sorry. I didn't. I'm sorry. No.
It's all right.
Okay.
Okay. Anyone else? Well, what kinds of things can we do to support the kind of medical approach that you were recommending, Steve? I recognize that there's not a lot that as civilians we're in a position to really do outside of not getting in the way.
No, I think I think there are many really creative things that are being done around the United States. There are creative things being done all over the world, by the way. And some of those creative things are more successful than others. The whole issue of drive-through testing sites, I thought was genius when the South Korea did it. I thought the use of immune globulin, and when we have enough blood that from folks who have recovered, I think that that's appropriate. Immune globulins have been used since 1900. So I believe, I'm not a clinician, but I believe that it could help if it's just one more tool in the toolkit. So I don't think there's anything that I would recommend that hasn't been recommended for civilians. We just have to be tough and resolute and hang together and help each other. That's the most important thing. Look out for each other. Look out for yourself first, and look out for others.
One of the things I've heard said is to sort of adopt a mindset that you are contagious, and that helps you kind of think about what where you might be putting others at risk as well as yourself?
Yeah, there was a 19-year-old lady who, young woman who got coronavirus, and she said from that day, she's told all of her friends, you know, we can't party, we can't do the things that we thought we could do. We thought we were immune. This is the infantry soldier that thinks at 19 that he is not going to catch a bullet, and everyone else is going to get it. And that's that kind of thinking just goes with youth, I guess. But it's really false thinking. Especially, I think the attack rate now is increasing in younger people. So more young patients, sadly.
Do you think that the restrictions that Governor Inslee put in a day ago are sufficient, or do they leave some big holes in your view?
Oh, I think they leave some holes. I think California probably, and New York, I think we're going to end up there more than we are right now. I understand the reason to go slow, but boy, oh boy, this virus is not going slow. That's for darn sure.
Dr. Cowen, do you have a question for Steve?
Well, I think I asked my question last night because I was particularly interested in the different strains of the virus, but I am trying to, also look for signs to be optimistic about, and I think there are a few of those. The degree of cooperation amongst the world medical community and the world scientific community has really been fantastic. I mean, entirely extra-governmental, but there's really been very wonderful sharing of information and cooperation, and a really unprecedented pace of useful investigations going on. So I think people should take some solace from that. There are a lot of very, very, very smart people working, on all the different sort of facets of this problem, from the, kind of epidemiology of the virus itself to potential mitigating treatments, antiviral treatments, to the testing, various testing regimes. It appears that a bedside antibody test will be available in, well, it's hard to tell, but it has been available in Korea for about a month. This is a test that can use a drop of blood and can be performed kind of like almost like a diabetes monitor. It could be done at home. It would test for antibodies to the COVID virus, and includes an IgM and an IgG result. One of those is a kind of a shorter term antibody, and the other is a longer term antibody. And so this would be very, very useful for people to be able to do a test like that at home, get a result in 15 minutes, not have to go necessarily to the doctor's office, again, reduce the burn rate of the personal protective equipment, of which we have precious little. And so that's very promising. And I believe, if I am getting the information right, the first FDA-approved test is supposed to ship on April 1st. So I think that could be a game changer if everything happens as, it all changes by the hour, but if that really happens, then I think that could be just, a very, very helpful tool. It isn't obviously a treatment. It isn't going to reduce the severity. It would provide many, many people we're finding in our experience that the respiratory tests, we're finding a very high, what we consider to be a very high false negative rate. This may partly be because many of these tests are being very delayed because we have so few test kits. And so some people who, when we get them sporadically, then we call people in and say, okay, you're on our list, come on in. We do the test, but it may have been 14 days or 30 days since they started having symptoms. So it's not entirely surprising that those tests would be negative, even if they had COVID. And then I think we are also finding, even in people with acute symptoms, kind of a shocking number of negative tests. I think this is something that is not well appreciated by the public. And even a patient was discharged from a local emergency room and told, well, you'll get your test result in a few days, and if it's negative, you can just, go back to life as normal. Of course, this was before the governor's order, but I do not think that anyone should be reassured in the presence of typical COVID symptoms, especially cough, fever, chest discomfort, and as reported in the New York Times yesterday, in a small number but a very interesting number of patients, loss of taste and smell, that should all be assumed to be COVID illness, even in the face of a single negative respiratory test. And at the moment, we just don't have the capacity to do the kind of sequential serial testing that really might be necessary to really, they are doing that in the hospital. Intubated patients who test negative are getting tested again, for sure. And there are many, many reports of people testing negative on the first test and positive on the second test.
Yeah,
and Steve,
David,
I've just noticed, I know you have a question, but
yeah,
I'm noticing it's 11:57.
Well, thank you. You're such a nice guy. I just wanted to add one thing. When you first describe a virus medically and scientifically, there are several 100 questions that need to be answered. We don't have data, but as the data comes in, your behavior changes. People are discovering the virus shedding can occur at a variety of different times in the sequence of disease. Before you're symptomatic, after you're recovered, for how long? Days is it? Is it hours? Is it several days that you can still shed virus and thus infect other people? Those are key questions that every day we find a little bit more information about. But it means keep our ears open and pay very close attention to the little summaries that you see out of CDC or at CNN, et cetera. They're very helpful.
Steve, I want to thank you very much for squeezing us in before your other meeting. And and if you feel as though this is you have information that you would like to distribute and share in the future, don't hesitate to either just show up at 11:30 or on a weekday, or give me an email and we'll let people know.
I'll give you an email and give you a heads up. Nobody wants to see me in the screen without some
warning.
Advertisement. Yeah, some warning. Thank you, everybody.
Thank you.
I appreciate it.
Thank you.
Thank you. Bye-bye now.
Okay. David, I muted you, so you'll need to unmute yourself because of that background noise. I wanted to make sure we could hear what Steve was saying.
Thank you.
So could you describe a little bit what the island-centric group, the MRC and Bainbridge Prepares, what you're doing?
Yes. So, that is also one of the stories that I think island residents should take great comfort from, which is that the pieces that have been put into place over the past 9 years, originally initiated by Scott James, who's the founder of Bainbridge Prepares, and who would probably be a wonderful guest for your conclave. He's a wonderful person, still very involved, and the pieces that he put into place after studying disaster response all across the country really have performed beyond, I think, what anyone could hope for. And even before this calamity affected us, I was often remarking to people that the Bainbridge is really blessed with an embarrassment of riches in this regard. First of all, we have people like Steve who retire here, which is, I told him that it was a little bit like being in a garage band and having Bruce Springsteen move in next door. He has been involved at the national level in this kind of disaster response. There are very few people in the United States that have the level of experience that he has. And to have him be an advisor and a colleague in helping to form our Medical Reserve Corps this past year, has been wonderful. But the components of that are in place are Bainbridge Prepares, and if people really want to look at this, they can go to the website, bainbridgeprepares.org, and you'll see there our organizational chart, which shows the, I guess I can't present it, but it shows the divisions of duties between Bainbridge Fire, which is its own entity, the city of Bainbridge Island, the emergency management under the leadership of Ann Lesage, who has a background in, you can, thank you. If you go to our teams, I believe, and then yes, that's the chart right there. Right, so, and in fact, I see Rita Ellsbury on the call, and her team is listed there under Bainbridge Prepares. But I think you can see that there's a really well thought out division of duties and responsibilities. A lot of it falls under Bainbridge Prepares, which has a very streamlined leadership structure, I would say very horizontal compared to what I've experienced in my, during like some of my federal training. And that horizontality, that ability to, and the fact that we all know each other and have worked together in a happy, I don't know if I would call it a happy accident, but happy occurrence. 9 of us, mostly from Bainbridge Prepares and the fire department, and Ann from the city, were in Anniston, Alabama at FEMA's Center for Disaster Preparedness in January for a week-long training where we got to work together solving disaster problems. Of course, somewhat ironically, our first tabletop exercise was pandemic flu. But I can tell you that it was a lot more fun as a tabletop than it's turning out to be in real life. Yeah. Because when you asked for masks during the tabletop, you got them. But anyway, that's an aside. But it was obviously a great opportunity, a great experience, and my part of the Bainbridge Prepares is relatively new. We just really only got our FEMA approval in late October, and then really started recruiting members in November. So, we really, if I'd been able to plan the pandemic, I would have delayed it a little bit. And I do tell people that we are going to be much, much better prepared for the next pandemic. I don't know how comforting that is, but that's for sure true. And so, we're doing what we can to kind of ready. We do have really, again, an amazing group of volunteers. We have almost 100 volunteers just since November. And to give you an idea, the entire state of Georgia's Medical Reserve Corps only has 100 members. So 100 members for Bainbridge Island is phenomenal. And many, I would say more than 2/3 are licensed healthcare professionals or recently retired healthcare professionals who were until very recently licensed. And so my job when I'm not in my day job at Virginia Mason has, along with my co-lead, Andrea Chimey, another community physician who has a practice to run, we have been scheming during all of our other time possible missions for this group. And the missions that have come to mind really are, well, there are two. The first one is one that Andrea knows about. The second one I haven't told her yet. But the first one would be and very appropriate and very doable for the group of people we've assembled, would be, for example, to staff an alternative care site. The county has reached a memorandum of understanding with the new owners of Messenger House. And one possible scenario would be to open the former Messenger House site, which is somewhat ready. I mean, it has beds, it has a commercial laundry, it has a commercial kitchen. My vision would be to use that as basically a mini hospital to offload the main hospitals of patients that do not have COVID, hopefully, but otherwise need to be in the hospital just because life happens and somebody has to have their emergency surgery and recover, or their diabetes is out of control, or they have cellulitis, or just all the usual things that we have people in the hospital for. In those kinds of cases, we would be quite able to handle, and the demand on special equipment and PPE would be far lower. And our volunteers, really, that would be right in their kind of sweet spot of, kind of what they've done during their careers. It wouldn't take a lot. We might have to look up exactly what the IV rate calculation is, but it's not an unfamiliar thing to us. Managing patients on intubating and managing patients on ventilators, that's not something that almost none of our volunteers are people who are doing that, and that would really be, I would say, last resort, probably not best use. The second idea that I have, and I'd be interested in hearing some feedback from your attendees, is that, as you know, Medicare and Medicaid have recently kind of loosened their guidelines and are allowing for this kind of telehealth visits to happen. And I'm concerned about what may happen in rural areas that are already only served by just one provider for a whole county. If that provider were to become ill or disabled in some way, there would be potentially thousands of patients across the country who would be cut off from care. And I'm thinking about trying to stand up a telehealth unit, which would really also help put to work our retired members who might not be the best people to be doing bedside care in the face of the COVID virus, but would be very comfortable doing this kind of care, and very experienced clinicians. So I'll stop there and see if you have questions or comments. Oh, and one more thing, if you could go back to, Reed, if you could take the screen again and go back to Bainbridge Prepares. I just want to make sure, and hopefully back to the home page of Bainbridge Prepares. Click home there in the upper left. So I think you can see there right in the center of the screen the word recovers. You might want to click on that. That is actually a link. I know it's not entirely clear to those of us who don't spend our whole life on a computer, but that is a link to this page to this wonderful site that is actually a special software that Scott James knew about and quickly appropriated for our use. And I really love how this site is organized, where you have the I have a need button. So if any of your seniors are people who maybe don't want to go out for one reason or another, or they have a need that they can't figure out how to solve, they could click that I have a need button, and in a confidential way, it doesn't just get like posted on the internet. It is it goes into a secure site. The need may be posted, but the name and address and phone number and all that of the senior citizen is not going to just be like posted on the internet. And then a person who's culling these and collating will go through, and then if somebody is a match to help them after screening them, then they would give them the contact information. So that's wonderful. And then if people have supplies or I don't know what that is.
Sorry, I was just going to show that we have a link on the Bainbridge Island
Senior
Center site. That will, if you can't remember how to get there, you can always just go to the BI Senior Center site, and you'll see that under the COVID news, there it is. So in case you forget this after the meeting.
Can you go back to COVID news? Because I didn't see the link for Bainbridge Island COVID-19 recovers. Oh yeah, that is a different page. That is the city's page. You could get to Bainbridge Prepares, it looks like, right there. Oh, and contact us at our recovers site. Yeah, that is to me, that isn't also obviously a link, but maybe your senior citizens are super savvy hacker.
Well, maybe make it a little more obvious.
Those are you've got the hackers on here on the call.
I'll make it a little more obvious.
Our senior cyber warfare team.
There we go. Now I have to figure out. There we go. Okay.
Does anyone have any questions?
I have a comment. Your suggestion or your recommendation on the telehealth is really valid and should be enabled, and we need some legislation at the state and federal level to support that.
Yes, I do think there is some enabling legislation, but it's quite complicated. As you may know, licensing is a 50-state deal, and it's totally up to the states. And like I've heard that Colorado will basically, if I just send them an email, they'll let me practice in Colorado. And I believe that is necessary for telehealth at the moment. I'm not sure that all 50 states have, just sort of thrown the doors open like Colorado has.
I'll send you some.
So yeah.
Go ahead.
I will send you some information on a firm that I work with here in the Seattle area that provides telehealth to mariners at sea, to the fishing industry and transportation people all over the world. And it's run by a physician that's an old friend of mine and developed.
Sure. I don't know if you're in the chat, but I will post an email address in the chat. It's quite simple. It's david@bainbridgeprepares.org.
Great. Thank you.
Mm-hmm. Thank you.
So one of the people on the call who doesn't have a microphone noted that the average age of the people in Kitsap County who have so far tested positive is a little over 44 age, based on the Kitsap Public Health information. Yeah. So obviously,
I think it's a little hard to make a lot of it just because the testing has been so limited that I would be worried that the data is kind of skewed. Obviously, it will be skewed to the sickest people, and so that's interesting that the age is so low. The average age of Bainbridge residents is considerably higher than 44.
Yep.
But there just hasn't been much testing here. But I would also say that, most people, even most seniors, don't, need to be hospitalized as a result of this illness. And so, getting COVID-19 is not, is different than having Ebola, and it's even different than having the SARS version of the coronavirus, which was much more deadly. So this virus is not that deadly. I do think that the Life Care Center in Kirkland, that is certainly an outlier, and I don't necessarily have a complete explanation for that, but I have seen some medical musings about dose response or dose effect, and the idea being that that there does seem to be some correlation between the severity of illness and the size of the inoculation. That is, somebody infected in the community by a relatively small dose of the virus may end up having a milder illness, all things being equal, than someone who is being kind of repeatedly and massively dosed. And that could be an explanation for what happened at Life Care in Kirkland, where they were really unaware, I think, of what was going on, and people were probably passing and spreading between the residents and the providers, and then also some of the physicians in China who succumbed to this may have been, being inoculated repeatedly and massively.
So it's, I'm guessing, just really difficult right now to have a picture of what's going on in our county, let alone in our state, given the lack of testing and questions about the various strains and so forth. You're really guessing at what's going on. Is that fair to say?
I would say that's true, certainly from a hard science standpoint. I mean, from a more subjective standpoint, in terms of just, how many calls we've taken from people with COVID-like symptoms, I think we've been, hundreds. And, I mean, maybe that's somewhat reassuring because, I don't think we've had any deaths in the county. And maybe very healthy people that are infected in a kind of normal kind of civilian way, do okay. I'm not saying that means we should ignore the governor's order or, the senior center should start their swing dancing club back up. Although I do think that's good for people, but not right now. I agree with Steve that until we have more tools in the toolkit, this is the only tool we have right now, is what the governor's doing, the social distancing, the remain close to home order. That's the only tool we have in the toolbox right now. And there are more tools that will come, and then we can kind of stand down some of these things over time. But yes, in terms of getting a really clear and accurate picture, very, very difficult. I tell patients that it's a little bit like flying a plane in the fog without instruments. But the phone calls, are some indication. I would also say that, I think that this has probably been around a lot longer than is generally recognized, and that Bainbridge has a much higher, and as does Seattle, a much higher than average visitation commuting between Asia and Bainbridge Island than a typical, than say Decorah, Iowa.
Yeah, it seemed to me like that was one of the things that might make us very much at risk. And we've been, in that sense, pretty fortunate to date, but that doesn't mean we should let our guard down.
Right. I think that's the prudent way to approach it. But I think the reassuring bit of that is that I suspect there has been way, way, way more of this than 20 cases.
Mm-hmm.
And, most people have done okay.
Well, if there are no more questions, I really want to thank you.
I have a question.
Yes, Betsy.
This is Betsy. Hi, thanks so much for all your help. I have actually 3 quick questions. One
Okay.
is a fever always involved in this?
I believe it's about 80 to 85% of the cases reported in China.
Okay.
But you certainly, there are, if you read that New York Times article, which I can post in the chat from a few days ago, or we can post it somewhere.
Yeah, I'll send it out to the email list
Okay, let me see.
after this call.
Let me see if I can find it. The loss of taste and smell, that occurred in some cases of COVID. It's actually, I think, occurs in a lot of cases of COVID, but in some cases that was the only symptom.
Yeah, my husband actually has that. And it's like, oh my God, we just read that. I think he told me 3 or 4 weeks ago that his sense of, but he doesn't have any other symptoms, so hopefully he won't.
Right. So, but please follow the CDC guideline, which I can also post in the chat. I'm not sure I can multitask here. I'm having trouble doing more than one thing at a time. But
that's on the CDC website.
Well, I'd like to give you a specific link.
Okay.
Let me see. Let me see if this.
I found the loss of taste article.
Okay. Oops. Now that little post is not going to work. Okay, hang on just a second. But the CDC has a great handout for people who are trying to sort of manage at home. And they turned it into kind of a graphic comic book style. It used to be about 30 pages of text.
Oh, wow.
Which I think a lot of my patients didn't like to read. So there in the chat now is the instructions. And I would follow those, including that your husband should probably be wearing a mask around the house. And if you don't have a mask, or staying in his area, whatever area you decide to designate as his. I know you may feel like the cat is already out of the bag or the horse out of the barn, but it still would be prudent to just follow these instructions and cleaning all of your doorknobs and refrigerator handles and oven handles with a dilute bleach solution, etc. It's all listed in there.
Okay.
If you don't have a mask for him, you can click on the link at the Recovers site. I have a need, and some very nice volunteer will hopefully drop a mask off on your porch, because there are nice people here on Bainbridge. We've set up a sweatshop system. Maybe it's not illegal if they're older volunteers to make. Reed said it was okay to have sweatshops of older volunteers.
That's right.
And they are cranking out terry cloth masks for us, which are not helpful for healthcare providers, but they're very helpful to help contain respiratory secretions in a ill patient who is at home. Excuse me.
Okay. How about CPAP machines being used too? I mean, he's got one of those.
Well, he can certainly.
We've been sleeping in the same bed for a long time.
Yes. Well, he can certainly use. He certainly should continue to use his CPAP machine, but I would recommend, if possible, staying in another room until he is, until his sense of taste and smell have recovered, or until. Well, it sounds like it may have already been 14 days since the beginning of the symptoms.
Yeah, I think it has been, and he also has immune suppressed system. I mean, I don't want to get into personal stuff, but because he had a kidney transplant, so.
Well.
But he seems otherwise totally healthy. At
the 14-day point, you're probably okay. But, there are some reports that I've reviewed that seem credible, that household transmission is actually relatively low.
Really? Wow.
Much again, Life Care Center.
Yeah.
We're not talking about Life Care Center. I'm just talking about people in their homes. It doesn't appear that there's as much transmission as you would think for people who have been living the way you have, blissfully, doing your normal routine.
Thank you. I would also like to ask about grocery shopping, because I have, wondered, should I go to the grocery store or not? I mean, I went last week once, wore gloves and got out of there as fast as possible and went when not many people were there. But there are also people offering to shop for, I mean, I don't know them, specifically, but so I'm just wondering about that.
Well, I think it is a really
It does.
I think it's a really
Rita does, yeah. Island
think it's a
Volunteer
really-
Care, I'm sorry, Island Volunteer Caregivers is offering to do that. So if you do need or would like somebody to shop for you, it's available. Call IVC at 842-4441.
I mean, out of an abundance of caution, I think that that's entirely reasonable. I just, remember that this virus is in a grocery store setting is spread by respiratory droplets. So yes, if people are coughing on the food, then and you pick up the item and then rub your eyes or scratch your nose or whatever, then yes, you could get you could inoculate the respiratory virus. But I don't really think gloves are going to help you as long as you wash your hands when you leave the grocery store. And anything you're going to cook, I wouldn't worry so much about. Things that aren't cooked, you should rinse off. I suppose if you're really meticulous, you could kind of rinse off the packaging. If you think that someone has gone and licked all the items on the shelf, like some guy I saw on Instagram or whatever it was, someone showed me on his Facebook post.
Yeah, oh dear.
People will do anything to get likes, I think.
Yeah. So, I've been washing stuff with soap and water, the food.
Yeah, I mean, I think that's beyond good. I mean, I would definitely rinse salad, but I would do that anyway, for lots of other reasons aside from. So I don't think the grocery store is super risky. I mean, I definitely would try to do the social distancing thing. And I'm trying to consolidate my trips where I might just have gone and run in just because I've run out of cayenne pepper. Now I'm going to probably put it on the list, and I'm going to get a few more things on the list before I just run in and do that one thing.
All right. Thank you very much. I really appreciate your help.
Sure.
So I do thank you for coming, and that was a very informative update for us. I think we're all grateful for the work that the people who are working in the MRC are doing, and a number of other people who are doing things like sewing masks and getting organized and driving for groceries for people.
Yes. And if people are interested in getting involved in that, I suggest they do go to the Recover site. There are, if you scroll down a little bit further, there are little bulletins posted. We need this, we need that. Can anyone donate this? There's all kinds of people. We may need more towels. I'm sure everybody has towels. Don't drop them off yet. Just check the site to see if they're needing more towels for the kids, because that's what they're making the masks from. And of course, if people enjoy sewing and want to do that too, that's great.